It's certainly convenient to create a drug that has the same kind of therapeutic punch, but doesn't require, adult supervision for a 6-hour trip, things like this. There's also, there's a lot of chemical work that I think you and others are doing, just moving atoms around molecules and saying, okay, well, how are these affecting animals? Can we develop drugs that have new therapeutic properties? Not necessarily the same therapeutic properties as psilocybin minus the hallucinogenic effects, potentially even brand new properties. There's a lot of room to play there, I think, from a chemical perspective and a drug development perspective. Can you start to give us a sense for how you guys at CaaMTech are playing in that space and what you're doing?
Oh, absolutely. I like that you use the word play because that has been largely the approach in that every week CaaMTech has a science party. That's the name of the meeting. It is an optional meeting for our scientific collaborators. And Nick, you would, as a scientist, you'd be invited if you wanted to check it out. And we basically have a rule that without any focus on anything commercial or patent related or anything like that, what scientific questions need to be answered, and with new scientific results, what other interesting questions are percolating to the surface. And so we've been doing that for, I think, 7 years. And over the course of those 7 years, we've stumbled upon some really interesting results. And then, you would know as well as anyone that each interesting result breeds really a whole new area of investigation and a whole series of other questions. And so to give you a couple of examples, and we'll start with psilocybin. Psilocybin is a prodrug of the active molecule psilocin. It turns out it's a pretty lousy prodrug in terms of being a drug. It's not very bioavailable. That group that gets hydrolyzed is hard to make in a synthetic molecule, and it's also
just for people listening. So psilocybin, we often say the word psilocybin when actually we're referring to psilocin, the active psychedelic compound in mushrooms. Prodrug means psilocybin is the precursor to psilocin. It has to be metabolized in a certain way before the active form is made. And then with all that in mind, we still sort of just use psilocybin as like a catch-all term. Is that accurate?
Very accurate. And the worst part of it, or at least my least favorite part of it, because I love chemical precision, people will use the word psilocybin to mean the mushrooms, whereas the mushrooms are actually like a biological cocktail of lots and lots of molecules, more and more every day. So to call that psilocybin while you're also calling a pure molecule psilocybin, same kind of mistake.
So talk a little bit about some of the things that you've been playing around with chemically in terms of, changing the psilocybin molecule, creating new drugs. What does that process look like? And what are some of the interesting candidates here and what they might be doing in animal models, say?
Sure. So if you're going to have to picture it in your head, sort of the molecule psilocin, right? Because again, psilocybin is a prodrug and it's inactive. With the molecule psilocin, first of all, I'll start with prodrugs. You can make an infinite number of other prodrugs of psilocin. So instead of psilocybin, which I've already told you is a pretty lousy prodrug, you can make all sorts of other prodrugs that have different solubilities and release or metabolize into psilocin at different rates, whether you want to be faster or slower. Prodrugs that get into the blood before they get hydrolyzed into psilocin, or those that don't. A whole area of investigation there.
So you can essentially make faster and shorter acting psilocin.
Absolutely. Like we can reduce the duration of a psilocybin experience down from about 6 hours to about 4 hours just by altering the prodrug.
I see. So you're not creating a psychedelic derivative in this case where you're subtracting out the hallucinogenic effects but trying to retain everything else. You're just sort of turning down the dial on the hallucinogenic effects, but it's still a psychedelic compound.
Oh, no, I'm saying exact same psychedelic effects. Wow. Exact same molecule, psilocin, that's your active molecule. But instead of getting to that molecule from the prodrug psilocybin, you can get to that molecule from a different prodrug.
Similar intensity of the subjective effects, just shorter duration?
Same active molecule circulating in your blood, reacting with the same receptors in the same way.
Wow! So it's like a kinetic thing. You're just it's affecting how quickly the drug is getting into your brain and circulating and going out. Basically.
Yes. And if you wanna go and connect that to some sort of commercial driving force, if it's a 4-hour experience instead of a 6-hour experience, maybe this patient is in the clinic for a more manageable amount of time that allows or comports with like the length of a shift in a medical clinic, and rather than requiring folks to be at the clinic for 10 or 12 hours.
So it turns out that the biology and the chemistry here are such that we're not going to be forced to make some absolute decision on, do we want to separate the hallucinations from therapeutic benefits? We can actually create the drug in a way that psilocin is just, it's still inside of you and you're having a shorter duration trip. So even if it turned out that you can't separate the therapeutic side from the psychedelic side, we still have this kind of chemical tunability that can make it a more manageable drug to be administered in a clinical setting.
Yes, absolutely. And in terms of modifying psilocybin or psilocin, this is probably the smallest possible way that we could modify it, right? Because we're literally administering the exact same active drug, just giving it to you a little bit differently. And with that, there's already a huge swing in effects and an enormous area of investigation before we start going and chopping the molecule up and making really big changes.
Wow. And so how do you actually do all this work? Are you, like, through CaaMTech, are you working with scientists in academic labs to run animal trials, then turn into human work down the road? How does that actually happen?
So again, the rule is science governs, right? So science party, what questions we want to answer, and how are we going to go and do that? Yes, it's almost all academic science. So we have scientific collaborations with universities where we're really an excellent funding source.